It is indeed unfortunate that every other young girl who walks into my clinic with irregular periods tells me, "Madam, I have been diagnosed with polycystic ovarian syndrome." I ask them, "How were you diagnosed? Was an ultrasound done? Do you have any acne? Do you have extra facial hair?" They say, "No, but because my periods were irregular, I was told that I have PCOS." So here I would like to make it very clear. For girls who are more than 18 years of age, the diagnosis of PCOS should be made very carefully. We as obstetricians tend to follow the Rotterdam's criteria. That is, the girl should have any two of these three factors. First, she should be having irregular periods, delayed more than 35, sometimes up to 2 or 3 months. She should either have acne or excessive hair on the face or the body, or the blood test should show that she has got high androgen levels. And the third important factor is the ultrasound, which should show that the ovaries have a bigger volume, more than 10 cc, and number of follicles in each ovary is more than 12. If any two of these are present in a girl, she is suspected or she is labeled as Polycystic Ovarian Syndrome. If only the periods are irregular, or if only she has acne or hirsutism, then we do not give her the label of PCOS. Hence, we need to be very careful because labeling a girl with PCOS tends to bring about the connotations that it may be very difficult for her to conceive later, that she is likely to develop diabetes, high blood pressure, hyperlipidemia later. Thus, as gynecologists, we need to label them only after they're fully investigated. And the girls, you need to ask your gynecologist, do I actually fall into the criteria of PCOS? For those who are less than 18 years of age and who have irregular periods, I would say it's quite common after you start having your periods to have irregular periods. And again, we do not label you as PCOS till 8 years after your menarche. We suspect that you have polycystic ovaries. We need to follow you up after the age of 18 or 8 years after menarche. And only then we tend to label you as PCOS if you still fill the criteria of the Rotterdams. There are two types of PCOS. Girls who are very obese, they may have polycystic ovaries, and sometimes even very thin girls are known to have polycystic ovaries. So remember, being overweight or obese alone does not mean that you have PCOS. Even thin girls can also have this. I hope I've made it quite clear as when we need to diagnose or put the label as polycystic ovarian syndrome to a young